everyone. Today I want to talk about treatment for HIV and a possible future treatment going through clinical trials. When I started taking treatment, I was floored how much the medication costs and will I be able to, and fearful if I could afford it. I started on Genvoya, which costs around $1,500 a month, so that would equal to about $18,000 a year. I have private insurance through work which covers only $10,000 a year. So thankfully there's a government program I signed into called Trillium, which pays the remaining, except for I have to pay a deductible according to my annual income. Some people can become resistant to their medication due to either forgetting to take their medication continually or contracting a different strain of the virus from having unprotected sex with an untreated partner. A pregnant woman should take treatment as soon as possible. I'm going to try to pronounce these medications they could take. Forgive me if I screw this up, but I'm going to try. Let's see. Nucleoside analog reverse transcriptase inhibitor with either ritonavir boosted protease inhibitor or an integrase inhibitor. So chances of your baby becoming HIV infected is less than 1%. If going untreated, it's about 25%. A 2018 stat in the US says fewer than 200 babies a year are infected with HIV. I personally think it should be mandatory for pregnant women to be tested for HIV to be on treatment because that significantly decreases the chance to less than 1%. From what I found, it's not. I was surprised to discover in the US that STI testing is automatically not covered, unlike in Ontario, Canada here. This, I would think, would deter some people from not getting tested, which is utmost important. I remember when getting a physical a few years ago from my family doctor, I asked him to include in the blood work an HIV test. Well, he told me that I don't need to ask because it's automatically there. I found that to be a proactive way to approach this disease. Knowledge is power, right? Treatment is also prevention. Here's a photo of a human T cell in blue, under attack by HIV in yellow. A report from Seattle in March of 2019. Monthly shots of HIV drugs proved to work as effectively as the daily pill. If approved, this new option would be great for patients, especially who forget to take their medication every day. I mentioned in this article about concerns about the cost of this drug. Also, they need to do more work on studies about will it protect sexual partners, which they believe that there's no reason why it wouldn't. I would consider taking this monthly shot, but if it has no side effects of long or short term. Otherwise, I would just keep taking my daily medication because I never miss. The studies were done in Europe and North America and in nations including Argentina, Australia, Russia, South Africa, South Korea, Sweden, Japan, and Mexico. This is the most exciting news that I found for treatment of HIV. HIV is a tricky virus. Research and development have come a long way though, and have improved greatly. One day in my lifetime, I hoped for a cure, but unfortunately, I don't see that in the near future. Michael K. here. Take care, everyone.